On behalf of Health and the state government, I'd like to thank individuals all across this state who have stepped forward and been tested, knowing that if you have any advice from New South Wales Health that you have been in a venue that we have named, or you're a close contact of someone who's been in those venues, or if you wake up and, as we just heard, a very aware young man, an 18-year-old, listened to the message and noted that he had symptoms. If you have any symptoms at all, of a cold or flu-like illness, or even just a bit of fatigue, you should actually get tested. Now, the Deputy Premier has highlighted the importance for regional people to be on the alert. Today we have this 18-year-old who has come forward and told us about his travels. I think that does reinforce the message that this is an issue for the whole of New South Wales. You can't assume just because you are in regional New South Wales that you either don't have the virus or you're safe from the virus being transmitted to you. Go and get tested. But particularly our focus is also in Western and South-Western Sydney. Obviously the issue at Baralla continues to be of high concern for New South Wales Health and the government. I want to say particularly to the people of Western and South-Western Sydney, thank you so much for coming out in increased numbers. But as the Deputy Premier said, we still need more. We need many more to come out and be tested. It is crucial for us, for New South Wales Health, to be able to be certain that we don't have chains of transmission that we're failing to identify. The only way New South Wales Health can identify chains of transmission is to come forward and be tested. Otherwise, they are not empowered in the job they have to keep us safe. As to the community around Baralla, I particularly want to say this to the community leaders. The community around Baralla is a very vibrant, multicultural part of Sydney. It is a community of many different peoples. What I would ask is the community leaders to actually step forward and make sure the particular community hears the message. You know best how to reach out to each of these communities, and I'd ask you to do that in whatever ways you can do it, and to stress the messages that New South Wales Health is sending, particularly in that Baralla region.